Ring, 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 ring.
Hello?
Hey, Doc. Your patient in 622, his alarm's been going off pretty constantly. What are you gonna do about it?
What is the monitor reading?
I'm not sure. I just keep going in the room and silencing it. I think it's probably AFib or something.
Uh, well, how long has his cardiac monitor been alarming?
I've probably been silencing it well over an hour now.
Did you do an EKG?
No, I'm calling to get the orders from you now. So everything about that conversation was wrong. Um, the correct way to communicate with a physician or any other provider that's a part of your patient's team would be to use the SBAR. S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. So I will give an example of what a correct communication with the provider would sound like. Hey, Dr. Johnson, this is Ashley. I'm the nurse taking care of your patient, Mr. Smith in room 622. Mr. Smith has had a change in his heart rhythm. He is status post a hip replacement from 2 days ago. His heart rate has been jumping up into the 130s. I'm thinking we should do an EKG and then probably start him on some cardizem to control his rate. So with that communication, the doctor has an idea of who I am, who I'm taking care of specifically, and what the situation is that's going on that he specifically needs to do orders for. In the first example, I did not introduce myself. I did not give a patient's name. Could be a whole new patient in that room now that he is not aware of anymore. Um, he knows that the patient I'm talking about is the same patient because I gave a little background on what they're there for. The assessment was that his heart rate was jumping up into the 130s, and I recommended doing the EKG and getting the medication for him.